Over the last century, there has been development of cutting-edge surgical procedures from what we call plastic surgery, mere filling up of defects with local or regional flaps, to microvascular free tissue transfer to ensure precise facial contour and restoring of function. Reconstructive parts of the body restoring appearances is our focus today on sound health. I am Olasunbo Modupe. Welcome. We begin with COVID-19 updates.
The World Health Organization (WHO) has validated the Sinovac Coronavac COVID-19 vaccine for emergency use, giving countries, funders, procuring agencies, and communities the assurance that it meets international standards for safety, efficacy, and manufacturing. The vaccine is produced by the Beijing-based pharmaceutical company Sinovac. According to Dr. Mariangela Simao, WHO Assistant Director General for Access to Health Products, the world desperately needs multiple COVID-19 vaccines to address the huge access inequity across the globe. She urged manufacturers to participate in the COVAX facility, share their know-how and data, and contribute to bringing the pandemic under control. In the case of the Sinovac Coronavac vaccine, the WHO assessment included on-site inspections of the production facility and validated that the Sinovac Coronavac product is an inactivated vaccine. It has easy storage requirements, makes it very manageable and particularly suitable for low-resource settings. WHO's Strategic Advisory Group of Experts on Immunization, SAGE, has also completed its review of the vaccine and recommends the vaccine for use in adults 18 years and older in a 2-dose schedule with a spacing of 2 to 4 weeks. Vaccine efficacy results showed that the vaccine prevented symptomatic disease in 51% of those vaccinated and prevented severe COVID-19 and hospitalization in 100% of the studied population. The WHO Regional Director for Africa, Dr. Mashidiso Moeti, has warned that African countries must urgently boost critical care capacity to prevent health facilities from being overwhelmed, even as vaccine shipments grind to a near halt. She said Africa is unprepared in the face of an imminent outbreak of a third wave of the COVID-19 pandemic in the continent, adding that the bottlenecks in vaccine deliveries and a lack of key resources in frontline care were pointers that Africa was not ready, even as she called for better equipment for the hospital and medical staff. Till date, 166,816 cases have been confirmed, 163,190 cases have been discharged, and 2,117 deaths have been recorded in 36 states. Globally, more than 173.5 million confirmed cases of COVID-19, including above 3.7 million deaths, were reported to the WHO. Above 2.2 billion vaccine doses have been administered.
Guest is Dr. Tuoyo Okoturo. He is the head of maxillofacial surgery unit of the dental department, LASUTH. Welcome to the program, Doctor.
Thank you, Olasunbo. I'm happy to be here.
All right. I'm going to ask you now, who needs a microvascular free tissue transfer in head and neck?
Thank you. We essentially patients who have defects all over the body who need some kind of reconstruction. Now, being a head and neck surgeon, when you have defects of the face, what I mean by defects is the patient has swelling in which there's some form of alteration of the face. Such a defect will need to be reconstructed. Now, depending on the size of such a defect, like you rightly pointed out, you have some what I'll call smaller flaps, local and regional flaps. But when you have a very large defect in which these local and regional flaps cannot fix, then we'll need to do what we call a microvascular free tissue transfer.
Clarify this in simple terms now. Is plastic surgery the same as microvascular tissue free transfer?
Well, you have an aspect of plastic surgery that involves microvascular free tissue transfer. For plastic surgeons, essentially what they do is they help reconstruct whatever defects that you have all over the body. So there's some crossover between what I do, which is the head and neck, and the plastic surgery. But yes, it's something plastic surgeons also get themselves involved in.
All right, doctor, is the procedure just for the neck and head? And can you please take us through the procedure now? And how long does it take?
All right. Like I said earlier, when you reconstruct every aspect of the body, every single aspect. And what is commonly known is some patients when you have mastectomy with breast cancers, so you have some plastic surgeons, they help reconstruct the breast after you've done the surgery for the cancer of the breast, which we call mastectomy. So those are mainly done by the plastic surgeons. But we also have some plastic surgeons who are specialized in just the face, in what we call a head and neck reconstruction. For me, the kind of training that I have, it's dual purpose. Not only do I resect, being a cancer surgeon, I also do reconstruction, so I do both. Directly answering your question, in terms of time, it's quite time consuming. We started this sometime in 2013, and the first case we did actually took 23 hours, where we had to reconstruct and we had to resect and we had to reconstruct. But that was more because we were just starting and we had a lot of issues. But now, on the average, somewhere between 10 and 14 hours from start to finish will involve removing whatever defect you have and fixing it. So somewhere between 10 and 14 hours.
It is a sort of breakthrough for the Lagos State University Teaching Hospital. Is it the first of its kind in LASUTH?
Yes, like I said, we started this a while back. Well, the procedure itself, it's not new. I mean, it's been on for 3-4 decades. But we've continued to try to see how best we can help our patients. And subsequent hospital administrations and even the state government has helped us. So what we're actually seeing today is a combination of the efforts of the state government who sent us for traveling, who sent us for training abroad, and the hospital management, and particularly the current hospital management that has really encouraged us in terms of providing what we need. Because it's one thing to acquire the skills, another thing to have what you need to acquire. So answering your question, yes, it's a breakthrough in the sense that it is routinely done. It's not just a one-off. If you come today to my clinic, that is a treatment option that is given to you. And then we have another case scheduled for in another 2 weeks. So it's routinely done and it's part of our treatment that we provide for our patients.
From your explanation, it requires transfer of a distant tissue, a donor tissue, along with its vascular supply to a recipient site. That's the defect site of the same patient. Are there options to get another donor rather than that of the patient?
Well, thank you. You really make a good surgeon. First and foremost, what we do is you have some defect somewhere, and which is created by the surgeon because we're removing, a tumor, maybe breast or whatever it is. For me, it's a tumor of the face, and so what we do is we have to fix that because the patient can't go about with that open defect. So what we do is we take another tissue from another part of the body of that same patient. Now it's not just taking the tissue alone, we also take its blood supply, that means the vessels and the artery and the vein. And we remove that and we transfer that to the face. And we reconnect that artery and the vein, those vessels, to the veins, the vessels of the neck, using what we call an operating microscope. and we use sutures that you can't see with your eyes. You have to use a microscope to do that. And once we connect that, we ensure that there's flow and the tissue that we've moved can actually survive. Now, your question was, can we take that from another
Donor.
patient, another ear outside the patient? The answer will be yes and no. Now, yes, for the kind of thing that we do, sorry, no for the kind of thing that we do, because we have various options. And of course, there's the issue of rejection and all whatnot, even the life expectancy of this patient, if you choose to take from another patient. So as much as possible, we try to use the same patient. And God is so kind to us that we have two of most parts of our body. But for things like heart and lungs and all that, and or kidneys, where you have just two and you lose two of them, then you have no choice but to take from another patient. But for the kind of thing that we do, we're more than happy to take from the same patient because we have options.
All right. No doubt the procedure has been successful. What are the risks and complications? Are there disadvantages of this procedure?
The risks, there are risks in everything, but the major risk which we struggle with is failure. Because not every flap, not every tissue that you transfer works. Like I said, the technique is so precise, and you're looking at getting vessels and using sutures that you can't see with your eyes to try. So you have some risk that comes with that. But the major risk is failure of that tissue transfer. But we have a solution to that. So what we do is, once we have failure, then we have to fall back to either a local or, in this case, a regional flap to fix that up. Yes, it won't be the same. That's why we didn't take it in the first place. But at this point, we have very little option when we have a failure. So that's about the major risk that we'll refer to. Now, every other risk associated with it is just the same associated with every other surgery that you carry out. This particular surgery, it's long. The hours are long, so we have to ensure that our patients are fit enough to undergo that. And once we ensure that, then the risk just pretty much comes down to the flap failure.
All right, let's talk about care and post-surgery now and how to deal with changes. Are there therapies needed after surgery, and how soon can a patient go back to his or her regular routine?
Yeah, thank you very much. A lot of our cases that we do are for cancer cases, so that level of care will be different from what I'm about to say. But some other cases we have are not cancer cases. Like the last case we did, which I shared with you, wasn't the cancer case. So, we've spent time in trying to build our team, and the team is not just the clinicians or the doctors or the surgeons. We also have the nursing team that helps, and also the physiotherapy. In some cases, we have to take a bone from the patient's leg. So such a thing will require rehabilitation. So we have the physiotherapists come in and help us with that. So we have a team in place. But overall, trying to quickly answer your question, it takes somewhere between, patients spend about, after surgery, they spend, 3 days max in the ICU. Then they spend another 7 to 10 days in the ward. It could be high dependency ward, or it could just be the regular ward, depending on how we see it fit. And depending on where we've taken the tissue from, patient will need some form of physiotherapy for the leg, if we've taken the tissue from there, or wherever it is we've taken the tissue from. And if everything goes well, under 15 days, patient should be out of, some do 10 days. Most of them do between 7 and 10 days, but at the very most 15 days, they're out of theater, they're out of the hospital, and they're up and running, and they continue their rehabilitation at home. I don't know if that answers your question.
Yes, it does. Thank you. LASUTH is presently the only hospital in Nigeria and one of the only two in Sub-Saharan Africa providing this mode of treatment. This must be quite costly, a life-saving. Or is it cheap, or is it affordable?
No, it's not. It's quite on the high side, but for the hospital, like I said, I give credit, I give kudos to the current administration. They've done quite well in terms of pricing. So a lot of our patients that we've seen would struggle to do it in a private setting in terms of cost. So that gives you an idea of, it's almost, it's going to be difficult for them to actually undergo such a treatment privately. So, but of course, the cost with the hospital, with the state government has really helped in trying to make them. I remember the first case I did was actually a hairdresser.
Wow.
It was just a hairdresser. That was the first case I did. And the last case we did, she's almost, what do you call them, those without parents?
Wow.
Almost like an orphan. Just had this very nice NGO who just helped us. Then we in-house again, we had to get some funding for her just to make up the funding. So yes, it's pricey, but the hospital is doing its bit to ensure that that shouldn't be a problem for our patients who need it.
Thank you so much, Dr. Okoturo, for your time and insights. We really appreciate your expertise. Thank you.
All right. Thank you very much for having me.
All right, that was Dr. Toyo Okoturo. He is the head of maxillofacial surgery unit of the dental department LASUTH on microvascular free tissue transfer in head and neck. Another feat achieved by the Lagos State University Teaching Hospital. Avail yourself of this bespoke reconstruction. LASUTH is not left out in the advancement of this cutting-edge practice. In fact, LASUTH is presently the only hospital in Nigeria and one of the only in Sub-Saharan Africa providing this mode of treatment. Sound Health continues with trending health reports. Please stay tuned. This is where we drop the anchor on today's episode of Sound Health. Whatever the ailment, seek medical help early enough. Stay safe always. Embrace all COVID-19 precautionary measures at all times. For comments and inquiries, please send SMS to 08035826603 or follow us on social media at LTV Social. #Sound Health. A sound health is a sound mind. Make healthy living your choice.